Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our series on embracing AI in healthcare. This is Dr. Candace Pierce with Elite Learning, and back for episode 2 is Dr. James Lamastro. In this episode, we are going to focus on integrating AI into our workflows, from training to data management and the ethical considerations for using AI. James, thank you so much for joining me for episode 2.
Thank you.
Yes, before we get started on these questions, I did want to highlight some workflow statistics. We know that there are some real problems today with the burnout of nurses being an all-time high. And then we have some vastly differing statistics on how much time nurses actually spend on documentation and all those administrative tasks, which can be as low as 21% to as high as 41% per shift. And having worked at a few different hospitals, I know that this is true on both ends, really depending on the processes of the facility that you work in. But what was not differing was the amount of time spent on direct patient care, which was around 19%. And every 10% increase in administrative tasks actually correlated to a 15% decrease in patient satisfaction scores. James, what are your thoughts on these statistics?
Well, obviously, we want to increase the amount of time that the nurse spends with the patient, and anything we can do, any device, any tool, any type of integrations of various systems we can use to do that, it's certainly going to improve patient engagement and patient satisfaction. Burnout's a very interesting concept. I mean, there is a lot of stress in nursing, and I don't think you're going to eliminate the stress in nursing and stuff like that. But I'm not really sure the stress is the real reason why people burn out. I think they burn out because they don't have the tools to be able to bounce back. They have to get back, to be resilient, to be able to say, okay, well, that was a crisis. We went through that crisis. Now let's go on and stuff like that. So if they're burdened down with a lot of mundane, administrative stuff, it really takes a lot of time and effort out of them, and they're not going to be there and available for the patient. And I think anytime we can put a system in place that increases the amount of patient nurse contact, we should do that. And that could be really, as you said, the benchmark for whether or not AI is working. How much time increases for the interaction between the patient and the nurse. And the more time the patient spends with the nurse, I suspect it's going to correlate with higher patient engagement and higher patient satisfaction.
Absolutely. And I think you really hit the nail on the head with when you were talking about how, regardless of what tasks we have to do, there's too much time spent on these administrative tasks, and there's not enough time that's really being given to the nurse to be able to be at the bedside and be the nurse that they want to be. And I also think that plays a bit into that burnout that we're seeing, is they're not being able to be the best nurse that they want to be because they can't spend the time that they need to spend at the bedside being the nurse to the patient, rather than electronics or paperwork or the telephone. But I did look at some implementation results. You want me to share those?
Sure.
Okay, so what I saw, it was really small, but hospitals that have started using AI for a lot of these mundane administrative tasks reported a 30 to 40% reduction in documentation time. And the other piece of data that I found was that healthcare facilities that used AI for scheduling reported a 20% improvement in staff satisfaction. There wasn't a lot of data, but would you say we're kind of still in the thick of the development of these tools?
Yeah, we're really in the thick of the development. We really haven't started rolling out AI. I think one of the systems that's really pushing this whole thing is the Veterans Administration system. They really have made a significant commitment to this, and I've been in a fair number of their facilities doing accreditations and surveying them and stuff like that. And I see a lot of improvement over the years as they implement their systems, as they put their systems in place. They're one of the ones, a few of them are the ones that have everyone has a device, and that device is connected to different systems, and different systems, and they're constantly improving upon that system, constantly working the AI, the IT nurse practitioner connection, so that they're increasing the amount increasing the amount of interaction with their patients, because they're taking away a lot of the tasks that, or minimizing a lot of the paperwork tasks and a lot of the tasks of recording and stuff like that.
Right, which is really good. And that's really what I want to talk about too is how, if you're in a facility that has not actually started integrating AI into their workflows, what are some of those effective strategies to help with integrating AI into your nursing workflow?
Well, the first thing you do is get a the nurses themselves and the leadership, and it needs to start talking about, how can we make this whole system better. And many nurses move from one system to another. So you may have nurses who come into your particular system that's not using a lot of AI, that have used it in other places. Those are the ones that could become the champions for using AI in the system, or administrators or managers or people like that, who come into the system and say, hey, look, I've been at this other system, or I trained in this system, and that way may become as well. You may have younger or newer nurses who have been trained in bigger or more sophisticated facilities. Although size doesn't really is not really a the only factor. You could have smaller facilities that could have AI as well, and so they need you to, as I used the word, agitate for looking at this as a way of reducing their paperwork and the time they spend doing this type of stuff, because they may have seen it in other places and they may see the benefit of it.
Absolutely. And what about the training that needs to come along with integrating AI into a nursing workflow?
Well,
What's the best way to train them?
it's well, the best way, but the way, some suggestions for training is, the first thing you need to do is to have all the people that are going to be impacted by those systems in the process, involved in the process. And the best way to do it, of course, is a needs assessment. And although we know what the problems are, it's good if we go down to the base nurse and ask them again, what are your needs? What do you spend a lot of time in? What would you like to see different, and stuff like that? So we're not just um, taking a package and applying to them. And
Mhm.
then we need to also take in terms of our staff development, is to have some sessions on basic AI principles. What can AI do? What can it do? So that there's a certain amount of literacy that is built up, because you want to build up the skill of using an AI. And like every skill, you're going to need a certain introductory. You're going to need a certain introductory to it, and you have to know the basic concepts and how to use it. And then I think that the next step should involve some hands-on experience here, and start small. Here's a simple way that we can integrate AI into our system. Let's try it. Let's put some mentors on the floor. Let's get some champions, some people who may get it quicker than others, and let them start the process of implementing this thing. And there's constant need for feedback. Is it working? Is it making your job easier? And it's going to take a lot of time, a lot of effort, and a lot of um, listening to people. You just can't take a system and say, off the shelf, and say, here. Even if it might work at one hospital, it might not work at another hospital, it might not work at another facility. And here, so you need to customize it to the particular culture that is in that particular facility. One facility may have a lot of younger nurses who are very adept at using iPads and cell phones and on Instagram, and used
Mhm.
to moving things around, pictures and everything else like that. Or you may have another facility that has a lot of older nurses who may not have had the same experience. Yeah, they use Facebook or FaceTime, and they use Facebook or and they FaceTime their grandchildren or their children and stuff like that. But they may not have the same level of expertise. So you have to adjust to that. And even within the facility, you can have various levels of expertise. So that's what you really have to do. I think it really starts with a real solid needs assessment, and then you can start developing strategies for your effective AI integration.
Right. Yes. Really knowing what you need, being able to build what you need, and having people start at the ground and help build it up so that you have buy in, I would think would be really important.
So buy-in is critical. It's not going to work unless there's buy-in. I mean, I remember we went from a paper record to electronic record, and we didn't spend a lot of time doing buy-in, and it's,
Hmm.
and it took us years for us to really see um, the real use of electronic record, because what we did is, because we weren't listening as well, as we just put the old paper record on the computer. So instead of being in pieces of paper, it was now on the screen, and
Right.
there was no really advantage, and you couldn't sell any advantage. And this was it.
Mhm.
So what?
Yeah.
I rather feel it. Well, I'm on the screen, and
I
then
want to
it just,
hold it. I want to flip it. I want to use my pen and my pencil. And I still feel that way today, being in critical care. And we had this specific documentation piece of paper and you flipped it. I mean, it had all these different tabs and turned it around and other people wrote on it too. And it was just right here in front of me. And I don't know. I still miss that. I having to click on all the different tabs and all the different pages to find what I need versus when it was all just right here in front of me, except my labs and stuff. But yeah,
well,
still
yeah,
have
but it
to.
wasn't really all there. You
Yeah.
still had to go through
What
this.
I needed at the time was there, and then I could,
You
you
still had to
had the
read.
other pieces of paper, but
You still had to read people physicians whose writing was illegible.
yeah.
And stuff like that.
Yeah.
So, I mean, it took a long time for the electronic medical record to really come to its fore and stuff like that, and really
Yes.
do its
Yes, and
promise.
you still have people that don't like to put orders into the computer. They still like to call you. They still like to try to get you to put them in, but it's even today, it's been years that we've had electronic health records and you still see that there's still not 100% buy-in of everybody yet, which I find interesting.
Well, I think it's going to change because um, for example, I have a good example. I have a granddaughter. We were in Scotland, and she didn't sign her passport, and the custom agent said, "Well, she needs to sign her passport." and and then he said, "Good thing he knew it." He said, "Make sure she connects all the letters," because she didn't know anything about cursive.
Yeah.
She used block letters and stuff like that. Now getting on the phone, doing things, moving pictures around.
Hmm.
It's natural. Giving her a piece of paper with something written on that's she can't handle
Hmm.
that. So I think
Yeah.
eventually, because if it's so pervasive, it's going to change that way because the culture in general is like that. But I think in the
Hmm.
beginning, when people didn't have their own computers and laptops and
Hmm.
iPads and stuff like that, it looked a little esoteric.
Right. It took a lot of time to get where you needed to get, to learn how to get to where you needed to get. And so now it's been around a lot longer. So it's getting a little bit easier. But when it comes to data management, what role does data management play in implementing AI?
Oh, data management is essential because you want to make sure the information going in is valid.
Hmm.
It's the right information. It's correct. It's reliable. And then when it gets transferred from one place to another, it gets transferred accurately because sometimes that happens. You don't want drop offs occurring and stuff like that. So the problem with data management systems, they're so large that they're often managed by data management departments, and sometimes they can be a little worlds. They could be their own little kingdoms and stuff like that. So
Hmm.
and so people understand that that's the patient's data. That's the data we're using in order to treat the patient. So we have to be very careful that we have full access to that data and that data is actually reliable. And that even the people who somewhat, as it were, control where that data is stored, that it's not their data. They're there to support us and help us and assist the nurses and stuff like that. Sometimes the IT department sees themselves as being and not the support, which they should be, but really being an entity to itself.
Mm-hmm.
And there should be asking them, not not how can I do it and tell me how I can do it, but I need to do it this way. Make it happen.
Mm-hmm. Right. And that really looking at implementing artificial intelligence from that leadership perspective that I know that you have, how can healthcare systems really be active in involving nurses and other healthcare professionals to have buy-in to help you design and really optimize the use of artificial intelligence, really addressing those practical concerns that their employees have?
Well, the leadership has to be committed to it, and that just it just has to be committed to it. They just have to say we're gonna use whatever systems we can to increase patient. They keep their eyes on the prize. The prize is to increase patient engagement and satisfaction, um, support practitioners who are at the bedsides and giving the care, and then making the operations as efficient as possible. So leadership really needs to be committed to those principles and whatever it happens. And if an AI system can improve um, the time a nurse spends with the patient, then they need to be committed to it, and they need to support it, and they need to provide the resources to do it. And the process has to start at the top and work its way through all levels. There can't be any levels which are not connected to it because otherwise it
Mhm.
will fail. The nurse is the end user of the particular system, but she depends upon a lot of other people up the line and laterally to be able to support that. So leadership has to really be committed to it, and nurses must insist that leadership is committed to it because it has been shown to reduce paperwork. It has been shown to help nurses avoid making errors. It has been shown to yeah, increase the amount of time that the nurse can spend um, with the patient and stuff like that. So those types of things are important, and those types of things are critical, and they need to put upon leadership that part of their responsibility is to support them in that particular endeavor.
And and from your, pick your leadership brain, what are some of those practical concerns that you've seen that organizations maybe should be aware of when it comes to trying to adopt something like this?
Well, I think it's the newness. People are just used to doing things a certain way, and an administrator may come in or a leader may come in and this thing is kind of foreign to them, and it involves relearning and stuff like that. And there's always resistance to change,
Hmm.
And how do I know this is going to really work? How do I know this is going to optimize? Is this just a new, fad that's going on? And to some extent, most leaders are somewhat conservative. They don't adopt they don't adopt the innovative ways of doing things. I mean, they may talk innovation, but they're pretty conservative, and to some extent, their 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 major goal their major purpose in there is to make sure that the organization stays afloat. So they may be concerned that if I invest a lot of money in AI and it doesn't work out, what's that mean, to the
Hmm.
bottom line? What's that mean to our ability to get other resources? If I invest in AI and AI, maybe I can't buy another uh, PET scan or I can renovate the emergency room or something else like that. So I mean,
Hmm.
those are all the concerns. So I think that in terms of getting leadership, I think a lot of it has to do with is people showing them that these are the results. And as it gets more accepted, as more people are used to doing it, they can insist upon it. That we have these type of tools, just like other tools. I mean, if you were doing manually checking of vital signs and this facility you've been hired to and you've been used to electronic um, monitoring system and stuff like that, you're going to come in and say, "What are we still doing this for?" And you could be a change leader in the thing. And the leadership and change doesn't have to come from the
Yes,
top; it can come from the
definitely.
bottom.
Being a change leader is very
And,
important.
and
And
they can
looking
actually
at
go ahead. I'm sorry.
Oh, no, I was going to say, looking at being a change leader and bringing artificial intelligence into your facility, one of the concerns that really just kind of jumped to my mind, that I don't know if it actually is a concern, but could it be that if we bring artificial intelligence in and it helps take some of that administrative work away, then is the facility going to then say, oh, well, I don't need this many nurses anymore on this floor. I can decrease the amount of employees that I need in this hospital because I've increased their amount of time at the bedside, which really just, I think, puts the nurses back at square zero, back to the same issues that they
Well,
were dealing with, right?
it's you'd be less than honest to say that that's not a concern, and that some may well use that as an excuse for reducing hours, or um, um, making up for short staffing, and it's just not going to make up for short staffing.
Right.
I think pretty much currently, I don't think there's enough staff as it is
Mm.
in either hospitals, nursing homes, or other healthcare facilities. So that anything we can do to increase the time that the nurse doesn't have to spend on these tasks is going to be the patient care, and that's going to increase the hours they're going to be able to spend with the patient. And I have a feeling that if we look at the hours spent per patient right now, given the staffing shortages and everything else like that, they're probably below what they should be, and what we need to
Mhm.
do optimum care. But related to the fact is that the nurses just need to be vigilant, and that certain leaders, certain administrators may not see it as an occasion. I can't say that it doesn't happen, and I can't say that I don't see it in the literature, especially in the so-called the industry literature, where they're looking at AI at reducing staffing and stuff like that, rather than enhancing the patient experience. It is
Right.
a definite risk.
Yes. That's saddening, but there's always those risks that are coming with these advancements, and I do think that this kind of ties us into ethical considerations. What are the ethical considerations that we should be thinking about when we're using AI in practice?
Ethical concerns.
Hmm. Yeah.
Okay. Well, there are a lot of ethical concerns. There's a lot of ethical concerns on AI, and I don't. My enthusiasm for AI. I don't mean to minimize some of those ethical concerns. And we, the nurse is still going to be responsible for the patient. She's still going to be responsible for the role in maintaining the patient privacy and confidentiality, as well as doing the patient care. So it's AI. She can't. We're not going to be able to use AI as an excuse um, for not being aware of that. And also, one concern has to be done, and depending upon the extent of the AI involvement in various facilities, the patient should be aware that they do, that the facility does, the organization and the nurse does use AI as a tool, and that well aware that when AI systems fail or cause harm, that we're still responsible, and it relies with all of us who have implemented the system, the institution, as well as the nurse. Um, there have to be some clear guidelines to establish accountability and correct any mistakes. There are going to be errors, and there has to be ways. But errors are missing the target, so to speak. And we have to look at those errors and say, what are we going to learn from these particular errors, and not just assess blame. Hopefully we've gone beyond the blame game when something occurs in an error and stuff like that. Well, just as you could have a medication error, that the person can get the wrong medication even on the old system without any AI input into it. We have to look at what systems failed that particular nurse in terms of providing that particular care or treatment or information. Um, and then the nurse has to have a role in how the AI is implemented. And also, as we mentioned before, in the bias that are built into algorithms, nurses can be very helpful in terms of understanding where the biases may come up because they're seeing the result. There's going to be a lot of issues relative to equity in access. Um, Hospitals and facilities that may be located in low income areas may not have the same
Right.
access to AI as other facilities because they don't have the same resources. So we have them, and rural facilities are in the same position. But so we have to ensure that as much as possible we're rolling out those same systems, or at least as many systems as we can to those facilities.
Hmm.
Has to be transparency. AI is not black boxes. You can look at the process, you can look at the steps, you can look at the information and everything else like that. So if something goes wrong or is a near miss or anything else like that, we can go back and look and say, what happened here? What are the steps that we have to take in order to correct it? What is our responsibility and accountability for being able to correct this particular system? Um, and again, you got to be careful. There's no over reliance on the system. It's not going to do the nurse's job. It's not going to make up if a nurse or a practitioner is not competent for their lack of competency. It's not going to skill them if they don't. It's not going to skill them if they don't have the skills to begin with. So the and we have to make sure that nurses have the ability because they're the ones who are responsible for overriding AI suggestion if they feel it's in the best interest of the nurses. And we have to make sure that we give as much training um, as we possibly can, and that we don't. Another ethical concern we talked about before: we don't use it as an excuse for reduced cost cutting or reducing staffing as well.
Yes. There's there's a lot to think about when it comes to trying to use AI as far as ethical considerations, making sure that the way that we're using it is effective but also safe for patients and that we have that overlying look that we are the final say, not the AI, whatever technology it is that we are looking at. So when it comes to using AI, when it comes to trying to bring that into your facility, are there some resources and support systems that would be available to help us to really look at how we can embrace AI in practice?
And there are, especially for nurses, the nurses seem to be getting into this a lot. The American Nurses Association um, has sections on health information and management systems.
Hmm.
University programs are starting to get more involved in it. I just noted that I live relatively close to the University of Mass, and their nursing department has developed a relationship with an engineering department. I just saw a notice of it. As a matter of fact, someone who I know is former dean is heading that up, and it's becoming an important part of their curriculum as well. There are professional informatics associations. I think there's even starting to be a certification in nursing informatics.
Hmm.
There is an alliance for nursing informatics, which is a group that looks at the implications of AI for nursing. There are a number of online platforms, and they're developing, and more are developing all along. I mean, there are general ones, and there are specific ones to nursing. There are
Yes.
there are getting to be a lot more resources out there, and of course, they're all available online, which is really wonderful.
Yes, absolutely. So that we can easily find them. As
Yeah,
we close out, oh, go ahead.
and if somebody wants to be certified, they could be certified online,
Mhm.
and and that makes it a lot easier. You don't have to travel to a place and stuff like that. So
Yes, absolutely. There's so much to be thinking about when it comes to artificial intelligence. And as we wrap up episode 2, James, is there anything that you want to make sure that you share or emphasize to our listeners?
just don't be afraid of it. It's it's an instrument. It's a tool. Um, Embrace it with caution. Embrace it, knowing that it's going to help you out, but don't be afraid of it. Don't see it as some sort of black box or anything else like that. It's a tool. It's a wonderful tool that we have. It's a wonderful tool that we have, and it's probably going to help us do our job a lot better. At the same time, but I don't have to emphasize because I think there's a lot out in the literature there. Be aware that there are some ethical and other professional considerations about its use, and just be well aware of that. And that be involved at every stage of the process. And don't let a system get imposed on you without your input and stuff like that, because the system is not going to work if you're not involved.
Yes. That's some great insight that you've brought to us today. Thank you so much for being here with us today. And I really just wanted to kind of recap a little bit of what you were saying in a couple of sentences. Just like healthcare is evolving, medicine is evolving, technology is also evolving. And I know, it seems kind of scary because we don't really know what it's going to look like. But I don't think the future with technology means that we're going to have to choose between human compassion, but also technological advances. And I think that what we're looking at is a sweet spot where they complement each other. And I really like the saying that I heard someone say is that maybe we can look at AI as handling the clicks while we focus on the care. What do you think about that?
Oh, I like that's a good expression. I'll write it down. I'm going to write it down.
Yeah, let AI handle the clicks while we handle the care. So I hope to our listeners, this discussion has given you some fresh insights into how AI can be really harnessed to support you, but not replace you as far as the human element in healthcare. These innovations, they should be developed with the goal of ensuring that you as nurses and myself and other healthcare professionals can really be fully present and focused on what matters most, and that's our patients. It's to help us really reclaim our primary roles as caregivers and educators and patient advocates. And I hope James being here today with us has really, thank you so much for taking time to educate us and to really help us understand and highlight the effects that AI is going to bring into healthcare.
Thank you.
Yes. For our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.